Hello, my name is Dr. Stephen Katz. I have been a practicing dentist for 40 years. For the last 15 years, I have been coaching practices to success. One of the things that I frequently see is doctors presenting treatment and then patients showing some forms of objections in the way of questions. A lot of doctors will feel that when a patient asks a question, they do not want the treatment. But actually, when a patient is asking questions, it shows that they do want the treatment, but they have some sort of obstacle in their own life that they need help in overcoming. The five most common objections that come up to treatment are cost, fear, time, sense of urgency, and trust. Cost is the only one of those that should be dealt with by the administrators in the practice, but they must be set up for success. So if a patient asks a doctor whether how much something's going to cost or how they're going to afford it, what they want to do is to set the administrator up for success and to build them up in some way, become a cheerleader for them. So what we recommend is saying that Mercedes, our treatment coordinator, is an expert at making treatment affordable for you. So that as long as Mercedes is able to fit the treatment into a budget for you, do you see any other reason why we shouldn't go ahead and schedule the next visit to begin the treatment? The next one that may come up is fear. Patient asking, is it going to hurt? Can I go to work afterwards? And those are expressions of fear. One of the skills that we use to overcome fear questions is something called feel, felt, found. Validation and joining and making a patient feel like they're just like other patients within the practice and guiding them to a better decision. So in this particular case, we'd say, I understand how you feel. Other patients have showed similar concern and asked the same questions. What our patients have found, though, is that Dr. Katz is extremely dedicated to making sure that you're comfortable throughout your experience. So that Dr. Katz will make sure that you have adequate anesthesia, Novocaine. He will stop and check with you during the procedure. At the end, he will ask you if you would like any medications and provide them for you. Dr. Katz will call you this evening and make sure that you are still comfortable. And somebody from the office will check in with you tomorrow to make sure that that's continuing. As long as you know that we are totally dedicated to making sure that you're comfortable throughout and after the procedure, do you see any reason why we shouldn't go ahead and schedule the next visit to begin the treatment? One that may also come up is time. How long is that procedure going to take? One of the questions with a question like that is you cannot give it the best answer if you do not know exactly what's being asked. And that question we don't know exactly. Somebody asking about how long a procedure is going to be could be a cost question. They may be relating time in the chair to how much pain they're going to have. It could be a fear question. It could be a fear question in the sense that the longer time in the chair, the more discomfort they may experience. So if you don't know exactly what somebody is asking, it helps to ask them another question to help narrow it down. The question I would recommend here would be, is there something in your schedule that's concerning you in setting up your next appointment? And that's when the patient could say that, finding convenient times is difficult because their work schedule is difficult. The response to that would be, we understand that your schedule may be tight and difficult. Therefore, ours is much more flexible. If it means that we're going to need to come in early or stay late or work through our lunch in order to give you a convenient time for your appointment, we will absolutely do so. As long as you know that we're going to create convenient times for your appointments, Mrs. Jones, do you see any reason why we shouldn't go ahead and schedule the next visit to begin the treatment? So as you can see, all of these objections can be turned into opportunities that enable a patient to go ahead with treatment if you handle them in a scripted and predictable way. I hope that has helped all of you in coming to a new realization that patient objections are an opportunity. And I hope that this will help you and help in overcoming what seem to be the blockages to going forward with treatment. And I hope that will help you become more successful in gaining treatment acceptance.